Sanford Children's Child Life Specialists are there to help children and their families cope with all the emotional, developmental, and social changes brought by illness, injury, or hospitalization.
Wendy Iwerks and Cassie Weiss are here to talk about how Child Life Specialists help ease children's fears when they're in the hospital. It can be a lot of fear when you end up in the hospital. So both of you, thanks for being here. So what do you guys do exactly? We got a lot of toys here. Is that part of the strategy?
We really take anything that's happening to a child. It could be an illness, an accident, and we're going to teach them about it. And so we brought some tools to show that we use to teach kids about when they come to Sanford Children's.
So I work in the emergency department, so a couple of common procedures that I teach kids about would be IVs. So we use the bear or dolls, which are normalizing for the children, and kind of just show them what the IV looks like, and we can use this as like play, incorporate play and really soft, sensitive language into our preparation. So, you know, talking about it as being like a small pinch and being a bendy straw and all those things can really help reduce the fear that they have during those procedures. And then here I have just like a doll that has like some stitches. So stitches is another common procedure we do in the ER. So they get to touch them, they get to feel what the stitches feel like after they're on, and we just talk about and show them some of the medical items that they might see.
And I know you guys have a lot of programs then too that you utilize. So what are some of those?
We do. One of our programs is a school reentry. So when a child is diagnosed with anything life-changing, it could be cancer, they could have had a trauma and have an acquired brain injury, we have a nurse and a child life specialist who go into the child's school and talk about what the diagnosis is, how it's going to affect the child as far as how they might feel, how they might look, their energy level. And then we also help kids to understand how they can support their friend. And when we've gone into the schools, the teachers and the staff and the family are so amazed at how we can take that very complex diagnosis and break it down so kids if it's a kindergartner or a senior, that they can understand what's happening with their friend or classmate.
Any tips for parents? I mean, we always find with Isabella that if you can have the conversation before it happens, it really mitigates a lot of anxiety. So any tips for parents on how to communicate about this?
Yeah, a tip that can be really helpful for parents is called comfort positioning. So it's just a positioning that we can use for a lot of our procedures where the parent gets to hold the child. It keeps the child secure enough so that they can get the procedure done, but it's also more comforting because the parent's right there. They can do comforting touch. They can have some toys or use their phone for distraction. So that can be a really helpful tip for parents.
Well, I think one of the things you guys do really well is getting kids in that kind of more active, the play. They can kind of forget about all the other things that are happening because that is their job, is to be a kid.
It is.
Absolutely.
It is. So we do incorporate a lot of medical play into everything that we're doing with our kids and our patients and their siblings too, because play is kids' work, and so it's how they learn. And so incorporating the play is really helps them to be comfortable with whatever has to happen while they're at the hospital.
Yeah.
We would fit right in, right, Larson?
Oh my gosh.
To both of you, thank you very much. We appreciate it. Stick around, much more. Actually, we'll be wrapping things up right after this.